Hi, I'm Dickie Spiroff, back again for our next segment in the home exercise program for the shoulders. Today's segment will be on isometric exercises. We use the isometric shoulder exercises for patients that are suffering from impingement syndrome, rotator cuff tendonitis. These type of activities will prevent any kind of irritation that's going on in the shoulder to be increased. So these exercises, there's not going to be any movement at the shoulder. However, we're going to be eliciting a muscle contraction so that there's no atrophy taking place in the shoulder, and that way we keep the shoulder strong. The first exercise that we're going to perform today is shoulder flexion. I'm going to have this patient step forward to the door. We're going to put a pad so that you can put pressure through your hand without having any pain. When you're setting up for this exercise, it's very, very important that you have your body mechanics perfect. Your shoulders want to be square. You don't want to be rounded out. You want to make sure your shoulders are back, good alignment. Your head is not down. It's in a neutral position. Your shoulders at 90, your elbow is at 90. You're not pushing down an angle here and you're not coming up here. You're perfectly at 90 degrees. When pushing on the pillow to elicit a contraction, you can push as much pressure as you like without having pain. Pain is our key. We do not want to have any pain with this activity. So, when I say to press into the pillow, you're going to elicit a contraction for 5, 4, 3, 2, 1, and relax. When you go into this contraction, you're going to go into it slowly. When you come off the contraction, you're going to come off of it slowly. Again, we're going to do it one more time. Shoulders are perfect. Head is nice and straight. Back is straight. Arm is at 90 degrees. And we're going to elicit a contraction. We're going to push. 5, 4, 3, 2, 1, and relax. Again, that shoulder flexion, that's working the anterior deltoid. Just vice versa to that is extension, shoulder extension. I'm going to have the patient, for demonstration purposes, we're going to go to the other shoulder so that you can see how we're going to set this up. We're going to work the posterior deltoid. Again, you put your pillow back here, you set your arm at 90 degrees, your shoulders at 90, you're not down like this, we're square across the shoulders, good posture, and then you elicit the contraction. You're going to hold for 5, 4, 3, 2, 1, and relax. One more time, again pushing back, eliciting the contraction to the posterior deltoid. 5, 4, 3, 2, and relax. Excellent. That was for shoulder extension, working the posterior deltoid. Now we're going to do what's called shoulder external rotation. You're going to put pressure through your wrist. When you put the pillow up on the wall, you set yourself again. So you're perpendicular to the door. You're going to have your shoulders are square, your arm is at 90 degrees, and the pressure that you're pushing in is on the back of your wrist. So you'll elicit the contraction of the external rotator muscles, which is also known as the infraspinatus. We're going to hold that for 5, 4, 3, 2, 1, and relax. And we're going to do it again. 5, 4, 3, 2, 1, and relax. That was working external rotation. All these exercises, you like to at least do 10 repetitions and hold for 5 seconds. If you find that after doing the first day you have no problem, no pain, you can then bump it up to 2 sets. But I recommend always to just start with 1 and take it from there. And as I said before in the previous course, that it's not a bad idea to warm the shoulder up either with a hot shower, a warm pack. However, when you're finished, you always want to finish with a cold pack for 10 minutes. So we just did external rotation. Now we're going to do internal rotation. And again, for demonstration purposes, we're going to switch to the other shoulder so that you can see how to set yourself up. You would come to the door frame, you'd open the door up, set yourself up so that you're, again, square with the shoulders, the arm is at 90, and you're going to put your pressure through your hand now, pulling in, working the shoulder internal rotators, also known as the subscapularis. You're going to hold that for 5, 4, 3, 2, 1, and relax. One more time, noticing his posture is perfect. Shoulders are back, head is up, and he's going to press in. Hold for 5, 4, 3, 2, 1, and relax. Beautiful, good job. Let's step back in. Okay, the next activity that we're going to perform is shoulder abduction. That's moving your arm away from the body. So when you look at the dittos that we have that we're going to provide for you, you're going to see that the external rotation and the abduction look quite similar. However, when you're doing the external rotation, remember you're pushing through the wrist. With this activity, you're going to be pushing through the elbow. So the setup is very similar to the external rotation. You're going to have yourself square. Notice the pillow's now on the elbow and not on the hand. So our pressure is now going to be placed through the elbow. You're going to push into the pillow. Again, notice he's square, his shoulders are straight, elbows are, the head is nice and straight. And we're going to push for 5, 4, 3, 2, 1, and relax. And we're going to perform that one more time. Again, push 5, 4, 3, 2, and relax. Shoulder abduction. The next activity we're going to perform is shoulder adduction, adduction. That's where you would squeeze in. On this one, you're simply going to take the pillow, put it to your side. Your arm is going to be bent at 90 degrees. Go ahead and turn just a little bit so you can see. And basically what you're going to do is you're going to squeeze into that pillow, working the adductors. Going to hold for 5, 4, 3, 2, 1, and relax. One more time. 5, 4, 3, 2, and relax. Great, good job. Remember, like I said before, the old adage, no pain, no gain, we don't go by that. If you're having pain, that's your body's way of saying you're hurting it, stop. You only go as far as you feel a good contraction without the pain. Remember, there's an irritation and inflammation going on with these type of activities that you were doing before this. So what we're trying to do is keep the shoulder strong without having any kind of irritation to it. Thank you again for your time.